Welcome back. The 8th edition of the Africa Health Business Symposium is set to be held in Sandton. This will be in partnership with African Centres for Disease Control and Prevention, with a specific focus on the role of the private sector in healthcare. The challenges and opportunities available for the private businesses will be discussed at the conference. For more on this, let's welcome Dr. Daniella Munene on to Newsnight. Thank you so much, Doctor, for speaking to us this evening. Can you tell us a little bit about the broad aims of the symposium? What do you hope to achieve at the end of it?
At the end of the 8th Africa Health Business Symposium in Johannesburg, we want a joint communique from all private sector that will be present, that we're going to support the Africa CDC in their new approach to public health. And this is called the New Public Health Order that has a 5-point agenda for Africa's public health.
Perhaps you can tell us a little bit more about those 5 pillars on which this new order is based.
There are 5 pillars to the new public health order. As you know, the COVID-19 pandemic showed African nations that we must take agency and more control of over our public health decisions. And so the Africa CDC very aptly promulgated this new approach. The first pillar is strengthening African institutions for public health. The second very important one is expanding our local capacity to manufacture our own vaccines, therapeutics, and diagnostics. Then there is investing in the public health workforce, because they are so few and we need to optimize them and increase the workforce, and we need to mentor them for leadership. The fourth pillar is in increasing domestic investments for health. And the fifth is action-oriented, respectful partnerships.
So the theme for this year is the role of the private sector in Africa's new public health order. How do you see the role of public-private partnerships, specifically in the healthcare space?
You know, when people think about private sector's contribution to health systems, they think mostly about the hospitals, where you go and find a private hospital. Or sometimes they might think about private health insurance, for instance. But we must think of private sector's contribution in real terms, because in reality, private sector contributes across the 6 building blocks of health systems. Think about service delivery, what I mentioned, the hospitals, the providers. Africa Health Business estimates that private sector accounts for 30% of service delivery across the continent. But in terms of health workforce development, we have a small contribution as well of 5%. In terms of health information systems, private sector accounts for development and rolling out of 70% of the systems that are used in terms of health information systems. Access to essential medicines, we account for 60%, 100% of which we account for manufacturing. And then supply chain, we share both public and private sector. In terms of financing for healthcare, on the demand side, we account for 20%. And in terms of leadership and governance, we also have a role. So I think private sector is not appreciated in terms of their contribution. And even still, we have way more to contribute, and we should leverage private sector more and more.
So recently, the national health insurance has become a hot talking point here in South Africa. And as you said there, many people have this perception that, private healthcare and the private sector are one and the same thing, or that they play the same kind of role in healthcare. So thank you for clarifying that for us firstly. But can you tell us more about the role of the private sector within this universal healthcare model and how that can be rolled out? Because so far as I know, there's only 3 countries in Africa who are starting to roll out a universal healthcare model. That's South Africa, Ghana and Rwanda. So we have, no real example of tried and tested success, or, a test case that's been proven.
First of all, it's such a good thing that African countries are starting to include universal health coverage as a right in their constitutions, in their health policies and regulations, and in their frameworks for access to health care. And so this is a first step. And then the next step is thinking, how are you going to finance it? How are people going to access these services in a way that's equitable and everybody can afford at least the basic services? Now, very few countries in Africa, you've mentioned 3 that have are rolling out a national health insurance scheme. There's also Kenya. We've had our national health insurance scheme for a number of years. It's a trial and error. No country has got it right. But one thing for sure is that there's no government on the African continent that currently has built the capacity to cover all of their citizens adequately. And because we know we have citizens at different socioeconomic classes, different abilities to access care, I think we need to involve both private and public sector in terms of healthcare financing. And so any national health insurance bill or law that does not factor in the contribution of private insurers, I think is making a mistake. I think the people to be covered are huge. The need is massive. And so we should pull together all the resources, resources from taxes, resources from specific contributions that are mandatory, but also voluntary schemes that people can get into to enhance their cover. And we need to encourage private sector to thrive. And so that would be my advice for anybody who's drafting a national health insurance bill across the continent.
Let's talk a bit about the role of regional unity in creating these public-private partnerships where they thrive. Many countries are so focused on trying to get their own universal healthcare model up and running, or there is so much conflict internally in a country in terms of what policy should be, that, you know, we sometimes forget about collaborating with our African partners. But why is regional unity so important?
Regional unity is so important for adequate public health in Africa because we are so divided by country lines. We are 54 countries on the continent, and that means 54 health markets. And so when you think about access to healthcare in terms of, you know, go backwards in the supply chain and think of the actual health products and commodities that people need to have for their healthcare, if we can unite regions to be one market, one health market with one regulatory policy, we can harmonize regulations. If we can build up the existing research and development institutions so that not every of the 54 countries needs to develop their own R&D. We need laboratories that can do clinical trials. We need institutions that can do bioequivalent studies. And so we need to approach these requirements to enable us access affordable medicines in terms of a unit as Africa, but also in terms of the different regions, so that we're not investing duplicities across the 54 continents. And that's why regional harmonization is so important, and strengthening the institutions that exist in any part of the value chain of health products to grow and serve a larger region outside of their own country. And then this way, Africans will have access to cheaper, affordable, and it will even be easier to regulate the quality of medicines with these regional mechanisms.
Thank you so much for your time and for speaking to us here on Newsnight. That was Dr. Daniella of the Africa Health Business Symposium.